Monday Health Minutes, sponsored by Valley Health.
Hi, I'm Melanie Schaefer. This is Valley Health Minutes. We've all heard about pharmacists, but have you ever heard of a clinical pharmacist? What exactly is that? We're talking with pharmacist Joel Turley today about exactly that. So enlighten us. What is a clinical pharmacist?
So a clinical pharmacist is a pharmacist that helps in the care team of patients in the ambulatory care setting, at least within Valley Health. They provide various drug information solutions. So when providers have a question about a patient's medication regimen or about what might be the optimal therapy for a patient, then they reach out to us. Or if patients need more intensive therapy or more intensive monitoring of their therapies and medication therapies, then they'll reach out to clinical pharmacy.
So are there any specific medications or conditions, or just a whole variety of conditions that a clinical pharmacist can help with?
So there's a variety of different conditions that clinical pharmacists can help with. Within Valley, the clinical pharmacists generally assist with hypertension. We have a target BP program to help monitor and titrate blood pressure medications to help patients control their blood pressure. We also help with diabetes, which is a pretty common issue within the tri-state area, and help monitor and titrate medications or insulins if they're required. We also help with anticoagulants or blood thinners and help patients that require, more intensive monitoring of medicine such as warfarin or Coumadin.
You mentioned the team approach.
Mm-hmm.
Tell me more about that. How does the clinical pharmacist fit into the team, and who is on the team?
So, through Valley, we're a well-integrated team as far as our nurses and physicians, nurse practitioners, and pharmacy and clinical pharmacy. We generally have a little piece of the puzzle that can help address issues as they come up for our patients. So we all generally discuss and find out what could be the best option for a patient regarding whether it be a cost of a medicine or side effects that they might encounter or how best to treat a patient. So
just lots of people that can have part of the conversation to get people to their optimal health.
Right.
Great. How do you learn more about clinical pharmacy? How can people learn more?
So you'd want to speak with your provider. If they deem that it's appropriate, they would probably send in a referral over to clinical pharmacy, and a clinical pharmacist would be following along with you and checking on all of your medications, any drug interactions that there might be, whether your medicines are dosed appropriately for your kidney or liver function, or any issues that could be related to your medicines. The clinical pharmacist will be taking a look at and making sure that there aren't any untoward side effects or issues that way.
So would this be a question that the patient raises, or the physician would bring this to life?
Well, it could go either way. If a patient feels like they're just really struggling with adhering to their medicines or taking care of their insulin dosing, then they could request it of their provider. Or if the provider feels like maybe a little bit more contact from pharmacy could be beneficial for this patient, then they may talk to them about it and see if they would like to speak with clinical pharmacy and send a referral our way so that we can help them.
Interesting. So patients can take that step if they'd like to.
If they'd like to. Yeah.
Interesting. All right. The ins and the outs of clinical pharmacy. Joel, thank you so much.
Thank you.
Thanks for being here for Valley Health Minutes. We'll see you next Monday.